Plastic surgery, always a hot topic, always evolving.
And joining us is a world-renowned plastic surgeon, Dr. Bahman Guyuron. Thank you so much, doctor, for coming back on.
Thank you. It's a pleasure to be here.
It's good to see you. So tell us what's hot right now. What are some of the big procedures?
I will say the hottest topic in plastic surgery is injection of fat, which contains stem cells. As we age, two things happen. Several things happen. One of the things that happens is we lose some volume in the face. In specific areas, we lose volume. And when we inject fat, not only we restore the volume, but fat contains stem cells. And the stem cells have the power to regenerate, rejuvenate, and change the elements that have been deteriorated over the years because of the time element, because of the, aging.
It sounds like a pretty serious procedure. Can you explain how it's done?
No, actually it is in fact a very simple procedure. We just suction the fat from the abdomen or other places that are unwanted and transfer it to the areas that are needed, like the face, eyelids, the creases, and sometimes even in the chin area we make the chins larger. With a needle, actually, there is no cut. We just suction the fat with
a surgery per se.
Well, it's a procedure.
Yeah.
It's a procedure. It's done in the operating room, but it is not. There are no incisions. We don't have any cuts. There's some bruising. There's some swelling, but generally it doesn't last too long.
I was going to say, so I would think with recovery time, since there's not a huge incision, this is much easier.
It is. It is actually a lot better for the patients, and also the discomfort is essentially minimal. They may have some discomfort in the abdomen where the fat is coming from, but where it is going, generally there's not much of discomfort.
Okay.
For people who are unaware exactly what a stem cell is and why you're doing this now and what the benefit of using stem cells, can you explain that, please?
Yeah, stem cells are the progenitors of the cells. Actually, all of the cells generate from the stem cells. That's why they're called the stem cells. They are actually younger generation of cells that we can convert them to different cells. Like a cell that is soft can be converted to bone, cartilage, and a lot of research is going on, including in our lab and other labs. And we're taking these cells that have so much power and guide them in different directions to generate what we want. In this, again, in the rejuvenation area, we're using these cells to actually make this skin glow that has been really damaged with the sun exposure.
Sure, and you're even doing a study about how these injections can help relieve migraines, is that right?
Yes, we are. Actually, we have demonstrated that patients with migraine headaches have deficit in the insulation around them. The nerves are like cable wires, power cords, and there's an insulation around them. We have shown that migraine patients do not have enough myelin. That's called myelin, and that can be repaired if we inject the stem cells around the nerve. And besides surgery that I've developed for migraine headaches, this is another technique that we're studying to see if with the same technique we can actually improve the migraine headaches or take them away.
Wow.
And that's why people from out of state and out of the country come see this great doctor, Dr. Bahman Guyuron, Department of Plastic Surgery at UH Case Medical Center, 440-646-2173. Go to uhhospitals.org/plastics for more information. Doctor, thank you very much.
We're lucky to have you. Thank you.